The use of aids to enhance performances is not anything new. Athletes of ancient Greece were said to have used performance enhancers. Runners drank a mixture of strychnine, which in small dosages is a stimulant, and in larger doses a poison, and wine to increase their endurance and running abilities. The first documented drug-related death of a competitive athlete was a cyclist in 1886 who died from taking a mixture of heroin and cocaine. In the late 19th century, caffeine and alcohol, nitroglycerin, strychnine, and opium were popular drugs used to enhance athletic performance. Steroids were first introduced in competitive sports in the 1952 Olympics. The Russian team was reportedly using testosterone. An American doctor discovered the Soviet secret and brought that information back to the United States. Steroid use is not exclusive to competitive sports. People may use it for other reasons, such as to look bigger and stronger. There are two types of steroids: corticosteroids, which are used to treat certain medical conditions. These have no muscle-building properties. Anabolic steroids are used for performance enhancing. They have similar effects to testosterone does in the body. There are three different ways anabolic steroids are classified: orals or tablets, which are to be swallowed; injectables, which either go into the muscle or under the skin, or by application to the skin, such as a gel or a patch. There are various ways steroids actually enhance performance. Faster recovery times occur due to steroids counteracting fatigue products such as lactic acid, and they also delay the nervous system reactions that cause fatigue. Steroid users develop intricate routines to maximize benefits of use and avoid detection. Stacking involves using 2 or more steroids at the same time to get multiple effects. Pyramiding is starting at a low dose, increasing the dosage, and then tapering off to a lower dosage. Oftentimes, as use of one drug stops, another may be introduced. There are many physical risks to steroid use. The possibility of having one or more of these symptoms is dependent on the amount of use, the duration it's used for, the type of steroid, and the method it's used. Clearly, the longer the use goes on, the greater likelihood these effects could present themselves. Also keep in mind, most steroids are obtained through black market, increasing risks associated with use due to no governing body monitoring the distribution of them. Numerous psychological effects could present themselves as well. The side effects could be intensified by pre-existing or current mental health issues. At times, with steroid use, it may be difficult to distinguish mental health issues from the actual effects of steroid abuse. A common psychological effect is referred to as roid rage. Users act very aggressively and hostile and sometimes violent. Steroids initially increase testosterone in your body, and it produces desirable effects such as increase of confidence, feeling happier and stronger. However, continued use becomes more difficult to manage with the addition of testosterone in the body. If a user decides to stop, there are withdrawal factors to consider, both physical and psychological. Some of these symptoms could last weeks or even months. Due to the severity of symptoms, there's always going to be a strong desire to return to steroid use. For the adolescent user, steroid use poses special problems. Teenage years are usually filled with emotional upheaval, confusion, sexual and body awareness, and feelings of immortality. With the introduction of steroids and its side effects, these issues are magnified to serious proportions. Federal law places anabolic steroids in a Schedule II of the Controlled Substance Act. The possession and sale of anabolic steroids without a valid prescription is illegal. Most professional organizations have banned steroid use and require drug testing in and out of competition. As proactive as some of these sports are, however, users try to stay ahead of testing procedures with masking agents and planning their use around the tests. For many users, there's going to be a strong desire to return to use. They will need a commitment of a steroid-free lifestyle. This may take some planning and, in some cases, outside assistance. Dedication to physical fitness and competitive sports are tremendous pursuits. Western society is based on competition, and excelling at sports is important for a lot of people. Using shortcuts, such as steroid use, is not only cheating and illegal, but it also puts you and other people around you at great risk.